Former mine workers in the Kagisano-Molopo Municipality in the northwest are undergoing health examinations at the Ganyesa District Hospital. And it's to check for lung diseases they possibly could have contracted while they were still active employees. It's all part of a campaign by the South African Ex-Mineworkers Council to identify miners who did not receive their social benefits as well as their occupational health benefits. Newzroom Africa's Refiloe Seboko joins us now for more. This is an important one, Refiloe. The kind of support that mine workers and their families should be enjoying has often eluded many families, some who didn't know they might have been eligible, and others who simply couldn't be traced. So this work is incredibly important. Just bring us up to speed and tell us some of the stories you're hearing there.
It sure is a very important one, Iman. I agree with you, but also even the ex-miners that are here, they're saying that indeed some of them, they could not be able to access information, but now that the South African former ex-miners council are here to assist them, it's going to indeed assist them to be able to get their benefits and also be able to improve the lives of their people. But like you say, they are here in the Ganyesa District Hospital under the Kagisano-Molopo Municipality. And let's speak to Jeff Moreke. He is the Secretary General of the South African former ex-miners workers council. Thank you so much, Tate Moreke, and welcome to Newzroom Africa. Talk to us about this program, but also, I mean, it's an important one in trying to assist these ex-mine workers that we are seeing here today.
Thanks, Refiloe, and good day to everybody, those who are viewing this program. We are in Kagisano-Molopo and we are going on with the program of the ex-mine workers. Remember, this is a legacy issue. A lot of ex-mine workers have not get their social benefits, their occupational injury benefit, their occupational diseases benefit. So we, as the council, we are trying by all means to make sure that they go into this process of the BMEs, that is your basic medical examination, so that we can determine as to whether the silicosis from the gold dust and the asbestosis from the asbestos mines have not yet damaged their lungs, as these diseases are a latent diseases. They don't show immediately when you are still at the mines. Sometimes after you left the mine, they will then start to appear.
And I want us to speak about the numbers. You touched on the numbers that you have picked up here in Kagisano-Molopo, but since this program has started, how many mine workers that were able to come here and get that assessment done?
In Kagisano-Molopo, we have more than 30,000 of ex-mine workers, because this area is the mine supplier in terms of the workforce in the mines. Now, since we started here, doctors can only take 20 of the ex-mine workers a day. But our doctors have tried by all means to put themselves under pressure, and they have delivered 127 so far. Those ex-mine workers have passed through, but we have not yet counted the number of today and the number for tomorrow. But 127 have passed into the system, and we are grateful that the doctor have indicated that out of this 100% that have gone through, 90% of them are eligible for claims because their lungs show the traces of silicosis and asbestosis and other diseases that are not confirmed.
And you're saying that the doctor has confirmed that 90% of them has confirmed that there are traces. But where to from here for those that have now been confirmed to have traces of occupational health diseases, and what will be required of them to be able to get their benefits?
We're gonna separate them into groups. There are those who are sick as a result of asbestosis, and we will then direct them to the offices where they have to do their claims. And then there are those who are sick as a result of silicosis. We will then redirect them to the Tiamiso Trust to do their claims there. If Tiamiso Trust or the Asbestos Trust cannot accommodate them because of the class action, we will then refer them to MBOD so that they can get their benefit under the Compensation Commission of Diseases. So we will be dealing with them separately in terms of where was this ex-mine worker working.
I was chatting to some of the ex-mine workers that are here. They're saying that it's not the first time they see a program like this around Kagisano-Molopo, and sounding like they are being impatient because they are not getting those benefits so that it can better their life. What is it that some of them that they're not coming here for the first time? They keep on coming to this program, but they are not getting the progress of what is really going to happen from here.
Yeah, you'll remember, Refiloe, that we indicated that doctors cannot take a large number of ex-mine workers at a go. And remember, ex-mine workers is within the region of SADC. It's not only in South Africa, it's not only in Kagisano-Molopo. We are dealing with more than millions of people here. So when their processes goes to the offices, the specific offices, say for instance to a particular trust, it's not only them here, 20 of them, that the process has to cater them. We're catering everybody in South Africa and everybody else outside South Africa within the SADC region. So we are processing claims for a lot of people from the entire SADC region. We are not specific to the South Africans. So hence, sometimes it takes long for them to get what they want, they have to get. But ultimately, they will get it because in the Northwest, we have more than 8,000 claims that we have processed at the tune of 248 million that we have already processed and people got their money. So it's a showcase that people will get their money. It's such that the process cannot just do it zoom at once. We need to process claims so that we may not have dispute at the end of the day. We need to make sure that this person got what is exactly that he or she should get.
Dr. Morake, thank you so much for your time. Let's leave it there for now. There you have it, Iman, the process that is ensuring that ex-mine workers are getting their benefits, but also Mr. Morake there highlighting some of the claims that were processed previously and even some of the mine workers that were able to get their payouts. We have engaged with the Department of Health in the Northwest Province that also indicated that there's about 180,000 across the province that is of ex-mine workers that they are trying to trace and also ensure that they are getting their benefits after these tests have done. And like you say, Mr. Morake has indicated that there are those that have been found to have traces of asbestosis and also silicosis, and therefore there will be a process that they have to undergo so that they will be able to be paid accordingly. And for some, they are saying that once they finally get those funds, it's really going to change their lives in terms of taking their children to school, in terms of starting the businesses that they've always wanted to have, particularly because now they are not employed anymore.
Refiloe, Seboko, thank you very much for that very important update.